So friends, very good morning everybody. Welcome back to Rama Sharma's IPMT. Today our discussion is about the classification of cephalosporins. How they are classified. Cephalosporins are as of now the largest selling anti-infective worldwide because of few reasons. One, they are highly bactericidal. So in immunocompromised or in other patients, they are effective. So they are bactericidal, highly bactericidal, and important is safety. They are safe during pregnancy. They are FDA category B, means during pregnancy, other than first trimester, they are considered to be safe. And pediatric safety also. So there are dispersible tablet, dry syrup tablet, and then oral and then parenteral also. So wide range of dosage form is available. And so because of efficacy and safety, they are the drug of first choice. They have replaced penicillins almost. Now penicillins are not much used other than only amoxicillin, clavulanic acid combination. Now how they are classified in different generations. So you know that as of now there are 5 generations of cephalosporins. So the first generation, 2/5, they are classified based on spectrum. That is what causative pathogen they cover, not on the year of development. Now this is April 2026. Even in this month, if you discovered a cephalosporin, this can be first generation if it is active against gram-positive bacteria more. So they are classified based on spectrum, not the developmental year. The cephalosporins were discovered long back, somewhere 1948-49, and from 50s onwards they were in clinical use. Cephrazidime was the first, cephalothin, the parenteral was the first one used, but there were problems, and then all the research, from penicillin was diverted to cephalosporin. So we see today more than 30-40 different beautiful cephalosporins. So first generation cephalosporin, friends, they are the one which are very effective against gram-positive bacteria. Until today, they are most powerful against gram-positive, remember. So if the antibiogram is telling that infection is due to gram-positive bacteria, even doctor can give today first generation cephalosporin like cefazolin or others. Now practically they are not used, reasons are commercial, we'll discuss later on. So first generation are very powerful against gram-positive bacteria and some gram-negative. Which gram-negative? Proteus, that is only mirabilis, E. coli and Klebsiella, some. Plus penicillin resistant Staphylococcus aureus, which was resistant to penicillin, is also covered by first generation. So this is the first generation cephalosporin. Now when second generation are the one which have extended spectrum against gram negative. Against gram positive, they are similar to first generation, and actually all are little weaker than first generation. Remember, against gram positive bacteria, all these second, third, fourth are little less powerful than first generation, but they have better activity against gram negative. So now they cover also, for example, as influenza, Enterobacter, and also bacteria resistant to first generation. So the stability against beta lactamase is little better. So second generation cephalosporin like ciprofloxacin, acetyl, sodium. Okay, so this is the second generation. Now when we come to third generation, they cover more gram negative, more than second. Plus where second will fail, third will work because of stability against cephalosporinase or beta lactamase enzyme. So they cover now all gram negative plus some like Neisseria meningitis is also covered. Plus by definition they should have activity against Pseudomonas aeruginosa, which is most dangerous gram negative bacteria. So the definition of third generation is cephalosporin active against gram-positive plus gram-negative, including pseudomonas. Okay, but remember, all third generation are not drug of first choice or powerful against pseudomonas. There are some cephalosporin which are the most powerful against pseudomonas, like Ceftazidime, which is third generation but the best drug for pseudomonas. Actually, some books, they classify also as anti-pseudomonal cephalosporins. So this is third generation. Plus, third will work even where first, second will fail. So gram-positive coverage is the same. They cover all gram-positive, Staphylococci, Streptococci, Listeria monocytogenes, okay, anthrax, and Clostridium. These are all covered by first generation cephalosporin. Okay, very good. All penicillin are the best actually for the gram-positive bacteria if there is no resistance. So, and now after third, when you move the fourth generation, there are some like Cefepime, for example. They cover gram-positive, gram-negative, pseudomonas, and also they cover methicillin-sensitive Staphylo aureus. So, methicillin-sensitive Staphylo aureus is also covered. Plus, where all three, first, second, third will fail, they will work. So, better stability against the beta-lactamase enzyme. This is how now advancement is going on. So, today in critically ill patients, Cefepime is drug of first choice. Okay, they use it, and safety they share the same. So, safety, efficacy the same. Spectrum is more, beta-lactamase stability is better. This is what is fourth generation cephalosporin. Now, after fourth, when you go, the fifth generation, there are two molecules at least. One is already approved, that is Cefiderocol. In USA, this is approved by US FDA as a parental therapy. Now, this fifth generation covers all gram-positive, gram-negative, okay, including methicillin-resistant Staphylo aureus, which was resistant to, you remember, from penicillin was the benzyl penicillin, and after that then they discovered methicillin, which was only parental penicillin. So if there is a resistance to methicillin, then no cephalosporin is effective, remember. Only is now fifth generation. So in MRSA or methicillin resistant Staphylo aureus, which is generally, Staphylo aureus is generally in skin infections. So that is covered. Plus gram positive and gram negative, including carbapenem resistant organism. So carbapenem like mepenem, celestine, meropenem, these are all carbapenems. If there is resistance to carbapenem, fifth generation will work. So the future in critically ill patient belongs to use of fifth generation. They will cover gram positive, all gram positive, okay, including all Staphylo, Strepto, Listeria, Corynebacterium, Anthrax, Clostridium. Clostridium has many species. For example, Clostridium difficile, which is antibiotic associated diarrhea, Clostridium tetani, which causes tetanus, or Clostridium botulinum, which causes food poisoning, or botulinism due to Clostridium botulinum. So these are all covered by fifth generation, plus also the one which were resistant to carbapenem. So there are two molecules, Ceftobiprole and the one which we just know, that is Cefiderocol. These are two fifth generation cephalosporins available. 6 also will come. So as the spectrum will be broader, new generation will come, or they will try to develop by improving side chains on the beta-lactam ring. The pharmacokinetically they will improve it. For example, one cephalosporin third generation, is the ceftriaxone. Now, why this is almost world's number one cephalosporin? Why? Because pharmacokinetically it has a long life. So dose is once a day. Although twice a day also doctors are giving, but once a day, 1 gram or 2 gram, once a day you can give. Maximum dose is 4 gram. So sometimes they give 1 gram BD or 2 gram BD, but once a day. So because of pharmacokinetic development, ceftriaxone has replaced other very good drugs like cefotaxime was the beautiful third generation cephalosporin, Okay, but it was more frequent. Every 8 hours, 6 hours you have to give it, or minimum 12 hours, and this was 24 hours. So probably the science will discover more cephalosporin by pharmacokinetic advantages in different parameters. So this is how cephalosporins are classified. Remember, cephalosporins are much safer. They share the safety of penicillin. They are better than fluoroquinolones. They are safer than tetracyclines. They are safer than chloramphenicol type drugs, because you can give them during pregnancy. During pregnancy, don't give tetracyclines, including doxycycline or fluoroquinolones. All fluoroquinolones are not to be used. Even aminoglycosides not to be used during pregnancy and in lactating mothers. But cephalosporins are good. So this is how there are 5 generations of cephalosporin, very widely used drug. Promote, and I don't think in many years to come better drugs will come. Only things combinations are coming. For example, they are combining beta lactamase inhibitor, or they are combining, these are beta lactam, that to organism to protect the beta lactam ring. So they combine with tazobactam, they combine with sulbactam, or they even combine with clinolenic acid, but this is more combined with amoxicillin. But tazobactam, sulbactam is combined with cephalosporins. I think some companies have combined even with meropenem. Okay, so these are nothing but they are beta lactamase inhibitor. They don't have their own powerful bactericidal activity. No, they only protect beta lactam ring. So the microbial activity is due to this beta lactam ring. So they don't allow tazobactam, sulbactam to destroy this beta lactam ring by penicillinase or by cephalosporinase enzyme. So if you are combined with ceftriaxone or with ceftazidime, now ceftazidime will work, and tazobactam itself will not work. Like piperacillin tazobactam is also, cephalosporin tazobactam. So many combinations are available in market. So this is in brief about cephalosporins. So I hope you have enjoyed it. This is 51 video. Now I take your leave. Probably for a long time there won't be more videos from my side. So enjoy, read them once whenever you have time. Knowledge is refreshing, is always better. God bless you. Thank you very much. Bye.